We're going to take a closer look now at what could happen the next time you need an ambulance to take you to the closest hospital. A new report this week warns that 500,000 times a year, an ambulance rushing a sick or injured patient is turned away from an ER that is full and forced to go to a hospital farther away. This ambulance diversion happens an average of once every minute and is already costing lives. We went to Los Angeles, where the crisis is acute. Friday night in Hollywood, paramedics respond to a 911 call. A 47-year-old man is hemorrhaging on the sidewalk.
See, the guy's been vomiting a lot of blood. He's got history of alcoholism.
The nearest hospital is close by, within a mile, less than a 2-minute ambulance ride away. But tonight, this man won't be going there.
So we're looking at our closest hospital is Kaiser Sunset, which is closed to ER. The asterisk next to the ER means there's no beds in the emergency room.
With no beds at the first, the next nearest hospital is again just about a mile away, Hollywood Presbyterian. But its ER is also at capacity and closed to new patients. So tonight, the closest open emergency room for this very sick patient is Glendale Memorial, almost 4.5 miles and 15 minutes away. What you are witnessing is called ambulance diversion. When the closest ERs are too full, ambulances are sent to hospitals farther away. It's a national problem, and in Los Angeles, it's a crisis. Ambulances here are diverted 24% of the time.
We're kind of used to it now because we do it so often, so we just try to make it work. We try to get them here alive. Sometimes we get them here alive, sometimes we don't.
Every minute may count when you have a critical illness and you need to get to a hospital.
Compounding the crisis, in the past 3 years, 9 Los Angeles emergency rooms have closed. There's a lot of red on here.
There sure is, and that red means closed.
It affects private and public hospitals. On the weekday morning, we visited the Director of Emergency Medical Services for Los Angeles County. All 4 of LA's public county hospitals had no room left in their ERs.
I believe people are dying because of this. Now, no hospital is going to tell you that, but I believe people wait so long that they are dying or they are suffering the consequences of these long waits.
So this is not just a poor person's problem.
Absolutely not.
Dr. Robert Splon has run emergency rooms and says the wealthy and insured are just as at risk of delays at ERs in private hospitals as in public ones.
We're one celebrity away from it becoming recognized as a national problem that it already is.
So somebody famous is going to have to get hurt or die even because of these delays.
Absolutely.
And those EMTs driving the streets of LA looking for an open hospital nearly every day say the system is broken.
Oh, there's plenty of nights where you're just searching for hospitals. You've got rescue ambulances tied up throughout the city, and you just wonder how much longer can this go.
And another sign that the emergency room safety net is broken, the average waiting time in the ER is now almost 4 hours.